That familiar orange box of baking soda, a staple in nearly everyone's kitchen, holds a certain kind of unassuming power. We use it to make our cookies rise, to absorb odors in the refrigerator, and even to scrub stubborn stains from our countertops. Its scientific name is sodium bicarbonate, a simple chemical compound that has been relied upon for generations. But beyond its culinary and cleaning applications, this white powder has gained a reputation as a popular, do-it-yourself home remedy. Many people believe it can soothe an upset stomach, or provide a range of other health benefits, a belief often passed down through family traditions and amplified by online forums. It seems straightforward, accessible, and inexpensive, making it an appealing first line of defense for common ailments. The idea of using a common household item for medicinal purposes is deeply ingrained in our culture. We often look for simple solutions to complex problems, and what could be simpler than a spoonful of something already sitting in our pantry? This accessibility is precisely what makes baking soda's use as a health supplement so widespread. People turn to it for quick relief from the discomfort of heartburn, acid reflux, and indigestion, hoping to neutralize the excess acid in their stomachs. The logic seems sound on the surface. An alkaline substance should counteract an acidic environment. However, this simplistic view often overlooks the potent chemical nature of sodium bicarbonate and the intricate workings of the human body, a combination that demands respect and caution. Before we delve into the perceived benefits and documented risks, it is crucial to understand what we are dealing with. Sodium bicarbonate is a salt, and like any substance we ingest, it interacts with our body's complex systems. When you drink it dissolved in water, it enters your digestive tract and triggers a chemical reaction with your stomach acid, hydrochloric acid. This reaction produces water, salt, and carbon dioxide gas. While this process can indeed lower the acidity in your stomach temporarily, it also introduces a significant amount of sodium and gas into your system. This is not the same as taking a carefully formulated and dose-controlled medication. It is a raw chemical intervention, and its effects can be more powerful and unpredictable than most people realize. The conversation around drinking baking soda is therefore one of balance and knowledge. It is a topic that requires us to look beyond anecdotal success stories and examine the scientific evidence. What does it truly do inside our bodies? When might it offer a fleeting moment of relief? And when could it pose a serious, even life-threatening danger? We believe in empowering people with clear, factual information so they can make informed decisions about their health. The goal is not to create fear, but to foster a healthy respect for the substances we consume, even those that seem as harmless as baking soda. We must separate myth from medical reality to protect our well-being. The primary reason many people reach for baking soda is for fast-acting relief from indigestion, commonly known as heartburn. That burning sensation in the chest, caused by stomach acid flowing back into the esophagus, can be intensely uncomfortable. Baking soda, being an alkaline substance, acts as a base that can neutralize this acid on contact. When you mix a small amount with water and drink it, it can almost instantly quell the fiery discomfort, providing a sense of immediate relief that is both potent and satisfying. This effect is not imaginary, it is a direct chemical reaction. For those who suffer from occasional bouts of acid reflux after a large or spicy meal, this quick fix can seem like a miracle cure, far cheaper and more readily available than over-the-counter antacids. Beyond simple indigestion, some corners of the fitness community have explored baking soda for another purpose, enhancing athletic performance. A few studies have suggested that ingesting sodium bicarbonate before a workout might help improve muscle endurance. The theory is that intense exercise produces lactic acid, which contributes to muscle fatigue. By increasing the alkalinity of the blood, baking soda could potentially help buffer this acid, allowing athletes to push harder for longer. While some research, including a 2020 meta-analysis, has shown a modest benefit in endurance activities, the evidence is not overwhelmingly strong, and the studies are often small. This potential benefit, however, has been enough to entice some athletes to experiment with what is known as soda loading, despite the significant risks involved. Another area where baking soda is sometimes used is in an attempt to relieve the symptoms of a urinary tract infection, or UTI. Some people believe that drinking baking soda can make their urine more alkaline, which they hope will reduce the stinging sensation during urination and inhibit bacterial growth. It is important to be clear, baking soda does not cure a UTI. An infection is caused by bacteria and requires antibiotics to be eliminated. While altering urine pH might offer a minor, temporary change in symptoms for some, it does nothing to address the underlying infection, which can worsen and spread to the kidneys if left untreated. Relying on baking soda here is a dangerous gamble that delays proper medical care. Finally, the appeal of baking soda is rooted in a broader desire for natural or alternative remedies. Many people are wary of pharmaceutical drugs and prefer to use substances they perceive as more natural. Because baking soda is a simple compound found in nature and used in food, it fits this description. This perception, however, is misleading. Natural does not automatically mean safe. Arsenic and cyanide are also natural, yet they are potent poisons. The allure of baking soda lies in its simplicity, its low cost, and its reputation as a time-honored folk remedy. But this allure can blind us to the very real and serious dangers that come with using a powerful chemical without a full understanding of its effects on the body. The most immediate danger of drinking baking soda is the high risk of overdose. Unlike a pre-measured tablet from a pharmacy, measuring a powder from a box is imprecise. It is incredibly easy to take too much, and an overdose can be poisonous. The primary culprit is the massive amount of sodium. A single teaspoon of baking soda contains over 1,200 milligrams of sodium, nearly the entire recommended daily limit for many adults. When you flood your system with this much salt, your body tries to balance it out by pulling water into your digestive tract. This can lead to severe diarrhea and vomiting. If the sodium gets absorbed into your bloodstream, it can cause dehydration, seizures, and even kidney failure, as your organs struggle to cope with the toxic load. A particularly frightening and rare but real risk is stomach rupture. This can happen when a large amount of baking soda reacts with the stomach acid you already have. Remember that chemical reaction we talked about? It produces carbon dioxide gas. A small amount of gas results in a burp, but a large amount, especially if consumed after a heavy meal or with alcohol, can cause the stomach to inflate like a balloon. The pressure can build so rapidly and intensely that the stomach wall can tear or burst. This is a catastrophic medical emergency that requires immediate surgery and can be fatal. It highlights the volatile power of this simple chemical when used improperly inside the delicate environment of your digestive system. The high sodium content also poses a significant threat to your cardiovascular health. For individuals with existing heart disease, high blood pressure, or those on a low-salt diet, drinking baking soda is exceptionally risky. The sudden influx of sodium can cause your body to retain fluid, which increases blood volume and drives up blood pressure, putting immense strain on your heart and blood vessels. In a 2016 case study, a baking soda overdose was shown to cause dangerously low potassium levels, a condition known as hypokalemia, which can lead to life-threatening heart arrhythmias. There have even been documented cases of cardiac arrest following an overdose. The link is clear. Flooding your body with sodium is harmful to your heart. Certain populations should never drink baking soda. This is not a safe remedy for children whose smaller bodies are far more susceptible to overdose and sodium poisoning. Symptoms like diarrhea and vomiting can quickly lead to severe dehydration in a child. Pregnant women should also avoid it entirely, as the high sodium load can affect blood pressure and fluid balance, posing risks to both the mother and the developing fetus. Furthermore, anyone taking prescription medications should be cautious, as baking soda can change the acidity of the stomach and blood, which can interfere with how drugs like aspirin, tetracycline, and certain heart medications are absorbed and processed by the body, rendering them less effective or even toxic. If after understanding all the risks, an adult with no underlying health conditions decides to use baking soda for very occasional heartburn, there is a specific way to do so that minimizes harm. The key words here are "and." The generally accepted guideline for a single dose is to mix no more than half a teaspoon of baking soda into at least half a cup. That's 4 ounces of water. You should stir until it is fully dissolved and drink it slowly. This is not something to be used daily or even weekly. If you find yourself needing relief for more than a few days, or for longer than 2 weeks, that is a clear signal that something more serious is going on. Persistent indigestion can be a symptom of conditions like GERD. gastritis, or even a stomach ulcer, which require a proper medical diagnosis. It is absolutely essential to consult a healthcare professional before you even consider using baking soda for any health-related purpose. Your doctor knows your medical history, what other medications you're taking, and whether you have any conditions like heart disease, kidney problems, or high blood pressure that would make this remedy dangerous for you. This conversation is not just a formality, it is a critical safety step. A doctor can also help you understand the root cause of your symptoms. Masking a problem with baking soda without treating the underlying issue is like turning off a fire alarm while the house continues to burn. Professional medical advice is your best tool for navigating health concerns safely and effectively. There are, honestly, many safer and more reliable alternatives for managing heartburn that you can find at any pharmacy. Over-the-counter antacids like Tums or Rolaids work by neutralizing acid but come in carefully measured doses, which dramatically reduces the risk of an overdose. Other medications, such as H2 blockers like Pepcid or proton pump inhibitors like Prilosec, work by reducing the amount of acid your stomach produces in the first place. These products have been rigorously tested for safety and efficacy and are designed specifically for this purpose. Opting for one of these approved medicines is always a wiser choice than reaching for the baking soda box, as it provides a controlled, predictable outcome without the severe risks associated with a raw chemical powder. Ultimately, the use of baking soda for health should be viewed as a last resort, not a first choice. It should not be used for chronic conditions, for detoxing, or as a general health supplement. Its role, if any, is limited to providing temporary relief for a healthy adult experiencing a rare bout of indigestion. Never exceed the recommended half-teaspoon dose. Do not take it on a full stomach, and do not use it for more than 2 weeks. This cautious approach acknowledges that while it can have a potent chemical effect, its power can easily tip from helpful to harmful. The line between a remedy and a poison is often a matter of dose, and with baking soda that line is perilously thin. In our journey through the science of baking soda, we have seen that this common kitchen staple is far from benign when ingested as a medicine. While it can offer fleeting relief from heartburn by neutralizing stomach acid, this benefit is overshadowed by a host of serious and potentially life-threatening dangers. The risks of sodium poisoning, stomach rupture, and cardiac complications are not theoretical, they are documented realities. The ease of overdose with a powdered substance makes it a particularly hazardous choice for self-treatment. When we weigh the momentary comfort against the potential for severe harm, the conclusion becomes clear. The dangers far outweigh the benefits for most people, most of the time. The appeal of a simple, natural remedy is strong, but we must resist the temptation to equate natural with safe. Your health is too important to entrust to a folk remedy with such a narrow margin of safety. This is especially true when there are numerous safer, more effective, and well-regulated alternatives available over the counter. Products designed as antacids provide a measured, reliable dose that avoids the guesswork and risk of a kitchen experiment. For persistent or severe symptoms, the answer is not more baking soda. It is a visit to your doctor to diagnose and treat the root cause of your discomfort, whether it be GERD, an ulcer, or another underlying condition. Let this be our guiding principle. Always prioritize safety. If you or someone you know has ingested too much baking soda and is experiencing symptoms like severe vomiting, diarrhea, muscle weakness, or difficulty breathing, do not wait. This is a medical emergency. Call the Poison Control Hotline immediately. The experts there can provide immediate, life-saving guidance. Quick action can make all the difference in preventing a tragic outcome from what may have seemed like a harmless home remedy. In conclusion, while the box of baking soda in your pantry is excellent for baking and cleaning, it should largely stay out of your medicine cabinet. The power of this simple chemical is too great to be wielded without caution and a deep understanding of its potential for harm. Make informed choices, consult with healthcare professionals, and opt for proven, safe treatments. Your body is a complex and finely tuned system. It deserves more than an imprecise, high-risk intervention. Stay informed, stay cautious, and above all, stay safe.